Hello, everyone. Welcome back. In this chapter, we will be covering epidemiology and neurobiology of addiction, and this is chapter 4 from Julian's Primer of Drug Action. In this chapter, we will be covering drug abuse history and current trends, neurobiological brain mechanisms believed to be responsible for addiction, and current approaches to treatment of dependency and abuse. So let's go over drug abuse history and current trends. In the 1960s, people started experimenting with more different types of drugs. For example, like marijuana, cocaine, and LSD started gaining popularity among people. And part of this gaining rise in popularity had to do with the war at the time, which was the Vietnam War. A lot of veterans and people who were in the war used drugs basically to treat PTSD and pain. And so this widespread use started becoming just more popular among people. In the 1970s, politicians started noticing how this rise in drug abuse was becoming a problem. And so they started to take action. One of the things that they did was to eliminate drugs that appeared in drugstores. So they basically removed products that contain any type of hardcore drugs. In fact, back in the 30s, Coca-Cola, which is a soft drink, used to have cocaine. And so before drugs were classified as harmful and addictive, at some point, they were used medicinally, and they still currently are used medicinally. It just depends on what type and what the dosage is. And so back to the story. So in the 70s, politicians started to take notice of this drug abuse, and President Richard Nixon came up with the DEA, which is the Drug Enforcement Administration, to basically help combat the use of drugs and also the distribution of them. The government came up with the Controlled Substances Act, which is basically a set of laws to help control the use of drugs and to protect people from harming themselves and what these drugs can do. And so a class of drugs, the depressants, stimulants, hallucinogens, and the ones that are classified as others, became categorized into certain schedules. And so there's 5 schedules. And basically these categories are criteria for substance abuse. And so the criteria will establish whether a drug is currently accepted as medical use and treatment, and it'll also establish how abusive that drug is and the likelihood of causing dependence when it's abused. So let's go over some of these schedules. A Schedule 1 drug is the most addictive type of drug, so it has a high potential for abuse, meaning that people will use it over and over again. Currently, there are no accepted medical use in the United States for these type of drugs because there's just no way to safely use them under medical supervision. And those drugs, some examples include heroin, LSD, ecstasy, peyote, spice, and bath salts. In fact, marijuana was included in here. And I'm not sure what the current laws are on that now, especially since quite a bit of states have legalized it. I did try to look it up, and I saw that marijuana was still a Schedule 1, but I'm pretty sure somehow the laws have changed over that, so I excluded it. Schedule 2 type of drugs have some medicinal use. So these substances have a high potential for abuse as well, meaning that they can be very addictive, which may lead to severe psychological or physical dependence. However, they do have medicinal use, and so that means that they are prescribed by doctors. And so some examples of opiates are methadone, so that can be prescribed by a doctor, oxycodone, a pain reliever, fentanyl, codeine, opium, morphine. These are all pain relievers. And some examples of stimulants include amphetamines, which is found in Adderall, and Ritalin and Disoxin, which is methamphetamine and methylphenidate. And so all of these are found in stimulant type of drugs. So these can be prescribed by doctors, but they are heavily monitored, and so you can only get a certain dosage and a certain amount for a certain period of time. Schedule 3 drugs are also prescribed by doctors, and these have less addictive qualities than Schedule 1 and Schedule 2, so people don't develop addiction to it as much as they would to the other drugs that we have talked about. And so these substances have less potential for abuse and lead to low or moderate dependence. And some examples are 90 milligrams of codeine. You can find that in Tylenol with codeine, Suboxone, and steroids such as Depo and testosterone. And so again, all of these are prescribed by doctors, and they're only legal when they are prescribed by doctors. Schedule 1 are the illegal ones that are not prescribed. They're just not used medicinally, and so using any type of Schedule 1 drug is against the law. Or Schedule 2 and Schedule 3 can be prescribed by a doctor, but if you do not get a prescription for it, then that's considered illegal. Schedule 4 has a low potential for abuse relative to the other schedules, and so this is yet less addictive than the others. And so those include Xanax. These are like anti-anxiety medicines, clonazepam, diazepam. The common names are Klonopin, Valium, Ativan, Versed, Halcion. So yeah, these are all Schedule 4 drugs. And Schedule 5 is the one that has the lowest potential for abuse and consists primarily of preparations containing limited quantities of certain opiates. And so these include cough preparation medicines, like a little bit of codeine, for example, like Robitussin AC and Phenergan with codeine. And so again, all of these drugs can be used medicinally if it's prescribed by a doctor, and if it's not prescribed by a doctor, then it's illegal. Like if you have a hold of them and if you're taking them, it's considered illegal without a prescription. And so these schedules were basically designed to prevent people from using drugs illegally. So in 2010, the Obama administration came up with another initiative to help combat addiction. And so this is called a National Drug Control Strategies Initiative. And so the aims were to treat drug abuse as a disease of the brain. And so instead of seeing it as a moral failure, like how it was seen in the past, and so there's a lot of negative, and there's like a negative stigma with people who use drugs. People view them as just having low morale, not being able to help themselves or be functional in society. But now, current findings in drug abuse are showing that drug addiction is a disease of the brain, and if it's treated like a disease of the brain, then we can find potential treatments for it. And so that was the strategy here in the Obama administration for National Drug Control Strategies Initiative, and also to design substance abuse prevention programs and treatment and recovery programs. According to the National Survey on Drug Use and Health, so this is NSDUH, this is basically like an annual survey on substance abuse and addiction in individuals 12 years or older. So these are some stats on drug abuse. So currently, and this is from 2017, so this is not like currently 2021, but this is from 2017. There's 27 million illicit drug users. 9.7 million of those have an actual addiction, and only 1.4 million are getting treated. 6.5 million are using non-medical or non-medically prescribed psychotherapeutic drugs, and 4.3 million people are using non-medically prescribed pain relievers. And so that means that these are drugs that doctors can prescribe. However, people are obtaining them illegally. And 1 in 5 young adults between the ages of 18 to 25 are currently using some type of illicit drug. And this is also the most common age for drug abuse in general. And the types of drug abuse that are found in this age are alcohol being number one, cannabis, and prescription drugs being the third. And so, over the years leading up till now, there has been a rising death toll from drug overdose, and those are from methadone, methamphetamine, cocaine, heroin, and opioids, and synthetic opioids. And one of the most current ones, and it should be way at the top, is fentanyl. So this is one of the number one killers as of lately. And so there's a curiosity as to why the rise in addiction. Why are there more and more people dying over time? And here we are trying to combat drug addiction and trying to come up with recovery and treatment programs, but yet you see a rising toll in people that are using. And so some of the answers to that is that there are more females that are using now, which increases the stats. It seems as though stress at the workplace has caused more people to use drugs, and also the steady rise of heroin use with people of income of 50,000 K or more. And that's an interesting one. And I don't know the connection to that. I don't know maybe if it's more affordable or something. But yeah, these are some of the potential reasons as to why there's a rise in drug addiction. And so some of the common risk factors for addiction are poor education, mental illness, poverty, parental substance abuse, so if your parents use, and environment, so if your friends use or the type of people that you are around can also lead to a risk factor for addiction. Here are some interesting videos that I'll have you watch on your spare time about drug addiction statistics, and they're short videos, but they're pretty interesting. So if you want to learn more, here are some more resources. Substance abuse is now categorized as a disease of the brain, and basically this can be found in the psychiatric books as to how to diagnose somebody with substance use disorder. And so this new category allows the diagnosis of people with alcohol and or drug problems, and it can be looked at in a continuum of severity. So for example, is a person mildly affected? Are they moderately or severely affected? And some of the diagnostic bases are to look at how impaired their personal control is, also how impaired their social situation is and how they interact with others, and also how risky is their use. And so are they being very risky every time they obtain the drug? And the good news about this is that it is basically seeing drug abusers as people who have a disease of the brain versus as viewing somebody with low moral integrity. So before we used to, the society kind of had a stigma on drug users as people who are weak or unmotivated, or they just don't care. It was just like a social stigma. But now, with all of this research, this current research, and all of the evidence that is coming up with the biological aspects of drug addiction, now we're realizing that it's actually a disease of the brain that can be treated. All right, so now let's talk about the neurobiological perspective and mechanisms believed to be responsible for addiction. Now, I'm only going to touch on some of the mechanisms. There's a lot of research out there. There's a lot of information in your textbook. I didn't touch on everything, just on some of the main things. So where does addiction start? And so addiction is strongly correlated, and this is according to research, to something that is called the reward circuit pathway. And so the reward circuit is a collection of brain structures and neural pathways. We will talk about exactly what brain structures those are in a few slides from now. And so the reward circuit is involved in feelings of pleasure. So all of the good feelings that you get from like eating, from drinking water, from like listening to music, all of the things that are associated with motivation, wanting, desire, craving, reward, all of that is associated with the word reward circuit. And so it is believed that um, drugs or drug use alters and stimulates this pathway. And so also know that the reward circuit is strongly related to pleasurable feelings. Okay, and so it causes you to repeat the behavior. So, for example, if you didn't like eating, you wouldn't bother eating. And if you don't eat, you'll die. You need nutrition. And so these reward pathways are very useful in our everyday functioning, and it keeps us alive. However, in the case of drug addiction, these pathways are being manipulated. The reward circuit pathway was first discovered by an experiment done by Olds and Milner in the 1950s. And this is a really interesting study done on mice in which an electrical wire, like an electrode, was fused to the VTA. And so the VTA is the ventral tegmental area of the brain. And that part of the brain is related to the reward circuit pathway. So just remember that. And so there was an electrode connected to it. And the mouse, if it pressed a lever, could stimulate its own VTA at any time it wanted. It can stimulate it. And so they figured out through this experiment that this was the biological basis of pleasure. And based on what the mouse did when it pressed the lever, they figured out that it basically relates to pleasure, satisfaction, and reward. And so the mouse is put in a cage. Here is the electrode that is connected to the VTA. And every time the mouse pressed the lever, it would stimulate its own VTA. And the mouse kept doing this so much that it didn't even care about eating. So it, started losing weight. It just started, becoming very skinny. It didn't even want to drink water. It didn't want to do those other things that are related to the reward pathway. The only thing the mouse is focusing on is pressing this lever over and over and over again. And what was interesting is that the researchers noticed that there is no point in satiation. Like, for example, when you eat, after some time, you become satiated, like you become full, and so you'll stop. And there's, quite a bit of things that we do in life, we become satiated and we don't continue doing them. But they said that it was really interesting that this VTA, that this, when it could be stimulated over and over and over and over again, and the mouse would never find like a satiation point. It just wanted to always do it. And so they made the experiment a little bit more trickier to see how badly is this mouse going to, or how badly does this mouse want to be stimulated at the VTA? Like, what is it willing to do? And so they basically put like an electrical grid on the cage. And every time the mouse touched the grid, it would get electrocuted. And so if you get electrocuted, that's very painful. The mouse did not care how much pain it was experiencing just to get to the lever. It would do whatever it takes just so that it can get to the other side of the cage to press that lever so that that lever could continue stimulating its VTA. So despite the challenges, despite the pain that it would go through, it didn't matter. The mouse preferred to be stimulated in the ventral tegmental area, which is quite interesting and quite powerful to see the effect of the reward pathway being stimulated and how strongly it can take a hold of us. So if you want to learn more about that or watch some videos, I found some cool ones. This one I believe is like from the 50s, 60s on that experiment. And so yeah, take a look at them. They're pretty interesting. So after some research, the brain disease model of addiction, which is BDMA, was put together. And so scientists figured out that drug abuse is related through the reward system pathway, and that neurobiological changes in the brain, so that means the chemistry in your brain, neuronal changes in the brain, are responsible for cravings and relapses due to addiction, which is why now they call it a disease of the brain. All right, so let's take a closer look at the reward circuit pathway. So what is the reward circuit? It's a collection of brain structures. And so this collection contains the hypothalamus, which is found in the center of the brain, mesolimbic pathway, and the mesocortical pathway. And so these are all of these structures that are that you can see here. They include the amygdala, the substantia nigra, the VTA, the ventral tegmental area, which is one of the major ones, and the nucleus accumbens. And it's also believed that this pathway here from the VTA to the nucleus accumbens is plays a very strong role in addiction. The prefrontal cortex is also stimulated, and the limbic area. So remember we talked about the limbic area in previous lectures, and we said that it is the limbic area controls emotions, and so it's not surprising that emotions are also being manipulated in drug addiction. So all of these regions of the brain are covered with dopamine neurons, meaning that they release a lot of dopamine, and it is also believed that dopamine plays the biggest role in addiction. So the release of dopamine is strongly related to addiction. And we learned that dopamine is associated with pleasurable feelings, positive reinforcement, so that you can repeat the behavior over and over again. And so addiction is basically related to that, in that the addiction of a drug gives that pleasurable feeling and that need to want to do it over and over again because these pathways are being manipulated by these drugs. Let's take a closer look at the reward circuit pathway. We'll start with the hypothalamus. And so the hypothalamus is critical for motivated behaviors such as eating, drinking, sex, and thermoregulation. If you weren't motivated to do these things, for example, like eating and drinking and procreating, then our species wouldn't survive, or any species wouldn't survive. So it makes sense to make these pathways rewarding. And thermal regulation is basically keeping warm or becoming cool depending on the environment that you're in. And it is believed that the hypothalamus is activated during stress, and stress can trigger the need for reward. So if you're feeling stress, and by the way, here's the hypothalamus, which is in the center of the brain. So when you're feeling stress, you will feel like you need a reward. I don't know if this happens to you, but I crave chocolate when I'm stressed, or I crave something sweet. And so I can see how that need for reward relates. But it is believed that the hypothalamus is strongly triggered in the reward circuit pathway to get a person to want to relieve their stress with a drug. So this is people who have become addicted or who are users. The mesolimbic pathway, which includes structures like the limbic system, ventral tegmental area, which plays a crucial role in addiction. The nucleus accumbens is another one that plays a crucial role. The median forebrain, which is yet another set of structures in the middle of the brain. And so it is believed that the dopamine pathway from the ventral tegmental area to the nucleus accumbens, which is here to here, is crucial to addiction. It is related to your attention cues. So paying attention to where things are at. So where is the drug at? Where can I find it? And also feelings of reward. Very strong feelings of reward are associated with these two areas. The ventral tegmental area connects to other portions of the brain and the rest of the limbic system. So, for example, to the prefrontal cortex, the amygdala, and the hippocampus, which is here in the center. And so the hippocampus, right here, is basically involved in drug addiction because it is believed to be involved in recording memories. So you remember the experience with the hippocampus. With the amygdala, you are mediating the emotional characteristics of the drug. So how does it make you feel? And so therefore the amygdala is manipulated because that memory of how it made you feel is there. And the prefrontal cortex is involved in planning and inhibitory control of behavior. And so you can, with the frontal cortex, you can plan, where's the drug at? Where can I find it? And since it's involved in inhibition or impulsive control, people who are addicted tend to be more impulsive. So they don't have control over their own impulses, or not as much control. The third part of the reward circuit pathway is the mesocortical pathway, which starts at the VTA, stretches out to the prefrontal cortex, the cingulate, and the perineal cortex. And so it's all of these structures here in the front. Remember, we said that the frontal cortex is related to motor functioning. So we had learned about this in previous lectures. And so your motor functioning is your voluntary control of your muscles. We also said that it's involved in compulsion, ability to assess risk, working memory, which is basically like your short-term memory, and your ability to inhibit compulsions. And so people who are addicted tend to have poor working memory and also a poor inability to inhibit compulsions. And so they're more compulsive. They're more quick to take actions instead of thinking them through. And so, so this pathway is basically manipulated through drug addiction so that it is catered to finding the drug and doing all things that are related to obtaining the drug. Research also suggests that the most abusive types of drugs tend to increase the amount of dopamine that is released from the ventral tegmental area to the nucleus accumbens. So just remember these two sections here. Remember these two areas, because if I ask you which areas of the brain are stimulated the most or are most heavily related to drug addiction, then you can answer the VTA to the nucleus accumbens. And so there are ways that these structures are directly manipulated. Directly means that dopamine is stimulated directly and increased. And so some of these drugs are nicotine, amphetamines, and cocaine. And if dopamine is indirectly stimulated, it means that the dopamine receptors or the dopamine neurons are not the ones that are being affected. Some other neuron is being affected, and because those other neurons are being affected, they end up indirectly affecting the dopamine pathways. And so those are heroin and other opioids, which act on receptors such as GABA. So they inhibit GABA so that you can have more of a stimulatory release. So all I'm trying to say with this slide is that some drugs directly affect dopamine, whereas other drugs affect other neurons that affect dopamine. However, the common thing is that dopamine increase is being manipulated. And when there's a dopamine increase, there's an increase of that rewarding pleasure feeling. So how do we know that the effect of drugs on the reward center is related to their pleasurable effects? And several studies were done to show this. One study was done in 1997 in which cocaine drug users or cocaine addicts were treated with methylphenidate. And so methylphenidate actually works like cocaine in that it blocks the reuptake receptors of dopamine. And so if it blocks it, that means that there's more dopamine available in the synaptic cleft. Having more dopamine means that that more neurons are stimulated. So we know that more dopamine leads to more pleasures of feeling good. And so these individuals that were cocaine addicts were given Ritalin, basically. And so they found that these subjects, when they were given Ritalin, when they underwent a brain scan, they showed that the greater the rating of the high, and so they were asked to rate how high they were feeling. So the greater rating of the high, the greater the neuronal activity. And so they saw that there was a correlation with the amount of activity or brain activity that was going on in relationship to how high they were feeling. All right, another study was done in which mice were basically they had their VTA lesioned. So that means that the part of the brain, and remember we talked about the VTA over and over again. We know that the ventral tegmental area, VTA, is very important in drug addiction. And so what these guys did is they lesioned it. And so lesion means to destroy it. And so they destroyed the ventral tegmental area. And they found that the mouse with that area destroyed just started losing pleasure, or started losing the need for doing what we call pleasurable things. For example, eating, drinking water, um, those type of things that are associated with reward and keep us alive. They found that the mouse was doing it less and less, so it started losing body weight. And the mouse, which is the control, that did not have a lesion, so there's no lesion here, was just fine. It was just living its normal mouse life. And so, just on this study alone, they found that mice with lesions ate less and lost weight. So that means that their natural reward pathways were manipulated, and so they basically got less pleasure out of it. So that's why they didn't have the desire to do it over and over again. And so they related that to the loss of dopamine activity, to the VTA. And so they correlated that. They said that if you lose dopamine activity in the VTA, you can also lose the feelings of reward stimuli. Um, and that in effect affects the frontal cortex, which becomes less active and less responsive to normal awards as well. So those interesting studies help people, or at least help researchers correlate the reward pathway with drug addiction. And there's another study that showed certain areas of the brain were less stimulated in people who have addiction. And so the addicted patients are on the right. And these addictive patients, when these brain scans were done, they weren't using drugs at the time. So they were sober at the time. And they were compared to a group which does not have an addiction. And so these are called the control. They did brain scan studies on the areas that have dopamine receptors. And they found with the brain scan studies that the people that had the more red in the areas, which means more activity, were found in the control. So all of the people in the control section, meaning that they don't have addiction, you notice that they have more red. That means that they have a lot more dopamine activity, these guys, in comparison to people who are addicted. People who are addicted tend to have less dopamine activity. So there's less overall. And the only way that they can increase their dopamine activity is through the use of drugs. But this is just to show that over time, over long-term effects, how dopamine receptors are less and less stimulated. And so this also leads to the overall feeling of finding less pleasure in life, finding less pleasure to do things, just because those neurons aren't stimulated as much. There are 3 types of receptors that play a role in drug addiction. And remember, we said that the receptors are the ones that receive the neurotransmitter. And so there are a lot of neurons that carry multiple types of receptors. And it's just found that these receptors, these very specific types, so dopamine receptors, glutamate receptors, and opiate receptors, just to name a few, because there are more that are involved in drug addiction. I'm just talking about these 3 in specific, are involved or play a role in drug addiction. We already covered the dopamine pathways, so let's talk about glutamate receptors and glutamate neurotransmitters, which also stimulate the reward circuit. Glutamate is also found in the ventral tegmental and nucleus accumbens area. And so remember we said that those 2 brain structures are strongly related to addiction. And of course, these brain structures have their neurons branched out to the other areas of the brain, like the frontal cortex. There also there's also a connection to the limbic system and whatnot. And so, interestingly, glutamate is also found in that section, and it stimulates those feelings of pleasure, just like dopamine does. And if you remember, glutamate is an excitatory neurotransmitter, meaning that it stimulates and excites neurons. That also means that they fire more frequently. And so, evidence from animal experiments show that chronic exposure to drugs strengthen the action potential. So, that means the communication between neurons, between the frontal lobe and nucleus accumbens. And this was shown as soon as 24 hours after exposure to cocaine. An experiment done with mice showed that if you block glutamate receptors, that cocaine was less rewarding for them, which is interesting. Um, so let me just repeat this. So if their glutamate receptors were blocked, meaning that they didn't have glutamate around to stimulate the brain centers, then they didn't tend to use cocaine as much as mice that did not have those receptors blocked. And so that indirectly shows that glutamate itself is also related to drug addiction. Opioid receptors is also associated with the reward circuit, and there are neurons that contain those receptors, and basically those receptors are also found in the VTA. So we know that VTA is that special brain structure, and also in the other locations of the reward circuit pathway that we had talked about earlier. For example, if an individual takes naltrexone, and this naltrexone basically blocks opiate receptors, then this prevents dopamine from being stimulated. And naltrexone is actually used as an addiction treatment, since people have an addiction to wanting more and more dopamine. Then blocking those neurons can potentially crave the risks or the need for wanting to stimulate the reward circuit. And so, since naltrexone actually blocks the opiate receptors, which prevents basically dopamine from stimulating neurons, that's how they know that opiate receptors must be involved in the reward circuit pathway. If you want to see some videos of rats on drugs, go ahead and take a look at these YouTube videos that I have provided for you. All right, let's talk about the last section of the overview of Chapter 4, which is current approaches to treatment of dependency and abuse. Let's talk about the biology of addiction, which is the way in which our brain is addicted. As a result of chronic drug use, natural rewards become less pleasurable and release less dopamine, and so that's the beginning of addiction. The frontal cortex becomes less active and responsive to normal rewards, but it's overreactive in response to drugs or the stimuli that predict the drug. And so if the drug is around, then the person becomes responsive to it. And if they know they're going to get the drug just by knowing, that tends to activate the frontal cortex a lot more. However, all of the other activities that are necessary, for your everyday survival become less and less pleasurable. So it seems like our brain starts hyper-focusing on the drug that it wants to obtain. The memory of positive effects of drugs provide the motivation for compulsive use, and it is believed to be responsible for relapse. So this memory is mediated by the amygdala and hippocampus. And so that's why there's other areas of the brain that are involved in addiction, because all of these areas of our brain are basically components of addiction. So the memory of it is a part of addiction. How it made you feel is a part of addiction. how you plan on obtaining it is a part of addiction, and so all of those actions require different areas of the brain. Over time, the stimuli that predict drugs produce a greater response to the reward pathway than the rewarding stimuli themselves. So if you know you're going to obtain a drug soon, that it's crazy to me, but that actually produces a stronger response than actually obtaining the drug. That's how powerful addiction is. And such condition or learned responses could elicit powerful cravings and sensations. So that need to want to obtain it, that need or that constant desire to have it is basically a part of addiction. The brain starts craving it. And in effect, the frontal lobe, the chemistry of the frontal lobe is profoundly altered. And overall, there are fewer dopamine receptors in the nucleus accumbens and other parts of the brain than there normally is, just like we've seen in the brain scans earlier. So there's pharmacotherapy, which means pharmaceuticals, so like actual prescribed drugs that you can get from the doctor to treat drug addiction. I know the irony in that, but I mean, it's true. You need something that can alter your brain chemistry to reverse what happened with addiction. So some of those current approaches still consist mostly of traditional, relatively specific therapies focusing on medications that affect the biological actions of primary drug abuse. Some of those medications are considered agonists, meaning that those medications replace the type of drug that the person is using and is very similar to it. Or it can act like an antagonist, which is basically blocking certain parts of the brain to prevent the feeling of addiction. So let's talk about some agonists. Some agonists are methadone, and so methadone is a replacement for heroin. It's kind of like a more mild type of heroin. So that's what an agonist means. It's just like replacing one for another. And so this helps a person reduce their withdrawal symptoms and slowly wean off of the drug, since there's quite a bit of drugs in which you can't just 100% stop in like 24 hours just because of the withdrawal symptoms. And so these agonists basically help prevent those withdrawal symptoms. Another one is nicotine chewing gum, and so it has lower doses of nicotine to help the body adjust to the decrease in nicotine. Another one is called dronabinol, which is a synthetic cannabis to reduce addiction. And so, it's just like another form of cannabis to help a person have less and less cravings over time. Antagonists basically block the drug. So, for example, if a person is taking naltrexone and if they try to drink or take an opiate, naltrexone blocks the ability for these drugs to bind on the receptors and stimulate the neurons. And we talked about naltrexone earlier. And so a person who is undergoing a treatment of alcohol-related abuse or opiate addiction can be given naltrexone. So in case they relapse and they try to drink, the drug won't really have an effect on them. However, this type of treatment, since there's no reward with this method, a person may stop taking the medicine, and then if they stop taking the medicine, that'll cause them to relapse. So all of these type of drugs, these antagonists, are useful. They may not be the most favorite way, I guess, of treatment. Another example is flumazenol, which is a benzodiazepine antagonist, meaning that it blocks benzodiazepines. And so, again, if a person is taking flumazenol, and if they try to take a benzodiazepine, it won't work on them because those receptors are being blocked. Same thing with doxycycline. So this is for a person who wants to stop smoking, let's say marijuana. It blocks the CB1 receptor. It's an antagonist, so it'll block it. And so if a person smokes, they won't really feel the effect of smoking because those, I mean, they will to an extent, right? But not as strongly because those receptors are being blocked. And so THC can't bind onto them. All right, so that leads to the end of the lecture. I will provide you with a study guide to answer questions and basically to guide you on how to study for this chapter. I did not cover everything in chapter 4, so you're only responsible for the information that I give you on this PowerPoint and on the study guide. If you have any questions, feel free to email me or come visit me in office hours, which is on Thursdays from 9 a.m. to 10 a.m.